Lance, cataract surgery has really changed over the past 30 years and things have really advanced, but tell us a little bit about where things have come from in your experience over the past 30 years or so.
It really has changed a lot. I remember the days when we were making incisions that were as big as the eyeball with 6 weeks recovery, and that changed a lot with phacoemulsification, as you notice. And we've gotten it down to the small incisions now that virtually have limited astigmatism. But now with the new advent of the laser cataract surgery, we can be more accurate than I ever dreamed we could be.
We'd really like to just take a moment to thank you for trusting us with your eyes, and your optometrist for sending you up our way. We really want to give each patient the very best outcome we can, and that starts with technology and it ends with execution.
The accuracy of these new systems boggles your mind. I've probably done close to 60,000 procedures in 30 years, and like it or not, it does it better than I can do it. When Dr. Wortz and I design a cataract procedure for you that's a refractive cataract procedure, we may use all or part or some or none of the laser cataract technology. And I can say honestly, were I to have my surgery tomorrow, I would lay down and I would have Catalys Laser refractive surgery for my eye. It's gentler, it reduces the energy, and it's reproducible so we can tune in the fine elements one needs to be able to see well without glasses. Haven't you found that?
Absolutely. I think in my experience, I was maybe a little skeptical. I thought, I can do this better than this laser.
Right.
And I've really found that this tool is something that far exceeded my expectations.
I think it's important as you consider laser cataract surgery to also think a little bit about the difference between the laser and manual techniques. For example, when we're using the manual technique, we use a needle and forceps to manually pull the capsule rhexis, or the opening in the capsule, around. While Dr. Ferguson and myself are both experts in this technique, no human hand is quite as good as the laser. And so with the laser, we're getting almost a cookie cutter perfect circle every single time. We want the lens to really sit in the center of the eye, and that provides a better refractive outcome for you. With the laser, we're able to image the cataract, and with that imaging, we're able to better line up the lenses. Again, while the manual technique is good, we feel the laser is a little bit better. And for patients with astigmatism, we want to use the laser because of the precision, image-guided cuts that the laser can make. They're so much more precise and so much more predictable than the manual technique. We feel like that's just another advantage for you. When it comes time to actually remove the cataract, we want to make sure that the cataract is as soft as possible. Now, some people wait longer and they have a very dense cataract, and in those cases, we really feel like the laser makes a big difference because the laser energy can actually soften the cataract before we even go in to remove it, and that decreases the overall energy that's used and can speed your recovery.
Probably 96% of our patients are on the money just with the simple Catalys procedure. However, some, because their cornea is abnormal or there's some other issues, they may need what we call an enhancement. And the enhancement is the excimer laser, and that's included. The very few that actually come to actually have that, they're shocked. They say, "You mean I don't have to pay for this?" I say, "No, you don't have to pay for this. That's our commitment to you." Our goal is to get you to see at distance, without correction, to do the majority of your tasks. And that's different for different individuals. The Catalys, like everything else, is a tool. And what the components that we use on one patient, we may not use on another patient. So we try to optimize that patient's chance of success. And it's just, if you saw this and it were 100 years ago, you'd think it was magic. Although Catalys laser refractive surgery has many benefits, it still carries some risks with the procedure, and these will really need to be discussed with you preoperatively.
While we know there's a lot of benefits to laser refractive cataract surgery, it's not covered by insurance. So you'll be speaking with a counselor in just a few minutes to discuss financing options.
I became an ophthalmologist because I really enjoy extending quality of life to patients. I know we don't always just save lives, but sometimes enhancing quality of life really adds quality to people's years.
And that dovetails really nicely with our mission statement, Gary. Our mission statement is simply to improve the quality of patients' lives through our commitment to surgical excellence and patient-centered co-management. In fact, we're really the only eye care practice that I know of that eye care is not specifically mentioned in our mission statement. Our focus is solely on the quality of your life.
I just really want to say once again, thank you so much for allowing us to participate in your care. We want you to achieve the same visual results that you want, along with your primary care optometrist back home. So thank you so much.